Melanie Taylor has been living with lupus since she was 16. It started in high school, where she started to experience symptoms.
I was having a lot of trouble walking, didn't know why. I was in pain all the time, constant fevers.
Taylor was soon taken to a hospital to be tested on what her pain could be. Her life changed after the diagnosis.
She said, you either have lupus or Lyme, or we're going to do some blood testing. And it came back and she goes, well, you have lupus. And I said, I have what? I 16, of course, I'd never heard of it. And I promptly asked her, am I going to die? And she just giggled and said no.
Since then, Taylor has broken out into 2 flares. She says she gets aches and inflammation, hair loss, rashes across her body, and the butterfly rash on her face, which most people think of when someone has lupus.
Sometimes I'll have all those symptoms. Sometimes I'll just have 1 or 2 and it knocks you down for a few days on how bad the flare is. I have been down for a month because my flare was just so extreme.
To combat these flares, she takes a lot of medications, like prednisone for her aches and immunosuppressants to make sure lupus doesn't attack her body.
And then because I do have lupus, it has also affected my kidneys. I have to take blood pressure medicine because I also have lupus nephritis with that.
And while Taylor will have lupus for the rest of her life, she doesn't let it affect her anymore. And she sees it more as part of her and her story.
Kind of become part of me. Like I don't as an illness anymore. It's more like, it's just my lupus. I have to do this because I have lupus.